One of the biggest challenges for every nursing student or professional is learning how to interpret an EKG, electrocardiogram. Recognizing a normal rhythm or identifying an arrhythmia can truly save a life. Today, we will learn in a clear and simple way how to identify four essential rhythms: normal sinus rhythm, atrial fibrillation, ventricular tachycardia, and asystole. Get ready, because by the end, you will have several easy tips to help you remember each pattern. Let's start with the basics. Normal sinus rhythm. Visualize it like this: PQRST, PQRST, all equal just like a metronome. It's the heart's organized dance. This is the pattern we want to see: the heart beating regularly in a coordinated way. Key characteristics that has this rhythm: heart rate 60 to 100 beats per minute, rhythm regular. The RR intervals, the highest peaks, are evenly spaced. P wave present before each QRS, showing the impulse comes from the sinoatrial node. QRS complex, narrow during less than 0.12 seconds. And finally, PR interval, constant between 0.12 and 0.20 seconds. A friendly tip for your learning: imagine each P wave as a green signal from the brain telling the heart, beat now. If you see a P wave before every QRS and the rhythm is regular, you're probably looking at a normal sinus rhythm. In short, regular rhythm plus P waves percent plus rate 60 to 100 is a normal sinus rhythm. Now let's move to a very common arrhythmia, atrial fibrillation, AFib. In this rhythm, the atria shake in a disorganized way without producing effect contractions. Visualize it like this: instead of an ordered PQRST sequence, you'll see a chaotic tracing with no defining P waves and R peaks appearing at irregular intervals. It looks like an electric rainstorm on the EKG line, which can cause clots and often requires anticoagulant therapy. Key characteristics: atrial rate extremely fast, may exceed 350 per minute. Ventricular rhythm irregularly irregular, no predictable pattern. P wave is absent, replaced by the small wavy fibrillatory F waves. And finally, QRX complexes, normally shaped but occur at uneven intervals. Think of the word party. Atrial fibrillation is like a party where everyone dances out of rhythm. No one follows the music, and that's why the rhythm is irregular and unpredictable. Now, let's move on to the rhythm that can be life-threatening if not treated quickly: ventricular tachycardia, VTach. Here, the electrical impulse doesn't come from the sinus node but from the ventricles, causing abnormal and dangerous contractions. Whenever you see this rhythm, always check for a pulse first, because what you do next depends on it. Visualizing a ventricular tachycardia. Imagine a series of tall, white, symmetrical mountains, one after another, with almost no spaces between them. It looks like a chain of peaks or an electrical airway. Key characteristics: heart rate 100 to 250 beats per minute. Rhythm usually regular, but P waves are not visible. And QRS complexes wide and uniform, duration greater than 0.12 seconds. Think of ventricular tachycardia as an engine out of control. The heart beats so fast and disorganized that it can pump blood effectively. Important facts: if the patient has pulse, treatment may include amiodarone or synchronized cardioversion. If the patient has no pulse, it's an emergency. Start CPR and defibrillation immediately. Memory clue: VT, vital tension. Always check for a pulse because the next action depends on it. Finally, we reach asystole, also known as the flat line. This is the reading of cardiac death when there's no electrical activity or heart contraction. Visualizing asystole. Picture a completely straight line on the monitor. No peaks, no waves, just electrical silence. Key characteristics: no P, QRS, or T waves. A completely flat line or small baseline oscillations, but always verify the wave amplitude before confirming the rhythm. No rate and no rhythm. Remember, asystole equals total absence. If you see a flat line, first check that the cable is connected and the equipment is working before declaring true as installed. Once confirmed, act immediately. Do not defibrillate. Begin high-quality CPR, give epinephrine, and search for reversible causes, the 5 H's and the 5 T's.
Here's a quick comparison according to rhythm, rate, P-wave characteristics, QRX complex, and finally, key notes for each rhythm.
Let's remember, interpreting an EKG is not about memorizing shapes. It's about understanding what the heart is trying to tell us. Practical steps. First, always start by checking the rate and regularity. Second, identify the P wave and the QRS complex. Third, relate what you see to the patient's symptoms. Fourth, practice daily with real EKGs examples. And fifth, use colors or mental drawings to remember each rhythm. If you pay attention to the waves, frequency, and regularity, you will quickly learn to recognize what's normal and what's an emergency. Finally, remember, the more you observe EKG tracings, the more natural rhythm identification will become. It's not about memorizing, it's about understanding the story behind each line. If this content helped you, save it, share it with your classmates, and invite more people to join Enfermeras en USA. Follow us on our digital platforms for more next NCLEX strategies, clinical lessons, and practice sessions. We're on Instagram, Facebook, YouTube, and TikTok as Enfermeras en USA and NCLEX con Enfermeras en USA. See you in the next episode, and remember, listen to the language of the heart through the eyes of a nurse.